Hi everyone, this is Dr. Kassimir here today to talk to you about irritable bowel syndrome, so also known as IBS. And this is something that I'm really passionate about because I feel like in the conventional world it goes overdiagnosed yet undertreated. And this is because IBS is multifactorial. There's so many things that go into it, so many things that can cause it or trigger it, and also so many things that are kind of interconnected with it that go more or less unrecognized in a conventional setting. So this video is for you if you feel like you have gone to the gastroenterologist, you've been evaluated, diagnosed with IBS, and you feel like the treatments that you were given weren't satisfactory. Maybe they worked for a little, so maybe a drug worked for a little to help with your diarrhea or constipation, but then they kind of stopped working even as you increased the dosage. Or maybe you were told to do low FODMAP diet, which might have helped for a little. Maybe you didn't get a lot of guidance on it and it was difficult to sustain. So I want to come and talk to you a little bit more about what you can do. If you feel like these treatments didn't help you as much as they should have, there also might be something more underlying going on that's contributing to your symptoms that can be treated in a different way. So I would encourage you to get farther evaluation to going deeper into a root cause for IBS. So different things that can play into IBS include mental health, which is very well known contributing factor to IBS and changing gut symptoms, so anxiety and depression, among others. So working on your mental health is definitely a big component, but it's not the only thing. Um, your gut microbiome also plays a huge role. So you may have just mild kind of changes in your gut microbiome um, that need addressing, that might need a little bit of help, or you might have some bigger kind of actual infections or dysbiosis going on that either are adding to your symptoms or maybe they're actually the cause of your symptoms and it's not IBS at all. So one of these things is SIBO, so small intestinal bacterial overgrowth, that I find goes often underdiagnosed in the conventional setting, but in many of my patients is actually found as the main cause of their symptoms. And this is diagnosed with a breath test. So you blow into something to get your breath, and it measures the gas that comes from the bacteria in your gut. So this is definitely an important step of evaluation if you have symptoms that are congruent with SIBO, which includes similar symptoms to IBS, so can have pain, diarrhea, constipation, but also has a lot of bloating and gas, which sometimes IBS does not have. I would also say to do a comprehensive stool analysis to look at your gut microbiome a little bit deeper. So if we're not suspecting SIBO, I might just do a stool analysis to get a better look. And it can also show us how your gut is doing with your immune system and inflammation, so things that they might have not picked up on like a scope if they did a endoscopy, colonoscopy, even if they did a biopsy. Um, and then I would also want to look at your blood work a little bit more in depth. So there are some hormones that can contribute to IBS symptoms. So our sex hormones can play a role, also our thyroid hormone. So thyroid definitely plays a role in gut motility, which is why in hypothyroidism you often see constipation, and in hyperthyroidism you might see diarrhea. And also cortisol, so your stress hormone. So this is one of those connections with the mind and the gut. Your stress hormone impacts greatly your gut motility and might contribute to um, IBS type symptoms, or just worsen or aggravate your symptoms as well. Um, and so these are just a few things that I would do to dig a little bit deeper if you are feeling kind of stuck with your IBS. And then if you want a little bit of guidance just right now with what you can do today to help your IBS, the first thing I would say is to try to eat mindfully. So This means getting your system into a rest and digest state that tells your body that you're getting ready to eat. So, your ability to digest your foods is really important in IBS. So, this includes how you produce stomach acid, how you produce your digestive enzymes, and how your gut is able to move food, not absorb it into your system, and also move it through your system and excrete it. So, setting yourself up for success is really important in that way. And when you eat, you need to be in a restful state in order for that to happen. So I know we live really busy lives, so a lot of the times I just recommend taking a second to take a few deep breaths in your seat before you pick up your fork, just to put your body into a more relaxed state. Saying a nice prayer or expressing some gratitude to your food, if that resonates, is also a really nice way to do that. And then if you are able, eating without distraction, and chewing your food slowly, maybe putting your fork down in between bites, this can all be really helpful. Um, and then some other just quick things you can do to set up your body for success for digestion is starting your day with some lemon water. This will get the proper um, parts going in your gut to help with digestion throughout the day. Other things that can help do this are eating bitter foods or drinking bitter teas. So something like dandelion root tea is really nice. Um, and also, just another simple thing that you can do is to avoid drinking water, a large amount of water while you eat your meals. So maybe sipping water throughout the day and having a little bit during your meals, but not a ton, because water can impact the way that we digest our food. So I talk about these things more in depth in my article, so go check that out. And I'm also having a class on April 23rd that goes more into what causes IBS, what's really going on, and going more in depth into treatment as well. So thank you for listening, and I hope to see you there.